Hi, my name is Dr. Ross Hauser, coming to you from the Hauser Neck Center in Fort Myers, Florida. I'm going to review one of my own papers. So for many years, from 1994 to 2005, myself, my wife, many of my staff, we would go down from Chicagoland to rural Illinois to run a charity clinic at in the First Baptist Church in Thebes, Illinois, a very poor area in Illinois, Alexander County. And then when the clinic ended, we had all these charts, like hundreds and hundreds of charts. So I sent them to Oregon, and Doug Puller, who didn't know anything about prolotherapy, he was recently retired, and he was a friend. And then what he did was he called the patients. So we have all this data. So this paper was on 94 patients. So it was 94 shoulder patients. And the patients just received Hemwall, Hackett-Hauser prolotherapy to the ligaments of the shoulder. And this is what we found as far as the results. So the main areas that we were treated were the tendons and the ligaments of the shoulder. The glenohumeral ligaments, the biceps tendon, the rotator cuff tendons. And shoulder joint instability can cause all these things: osteoarthritis of the shoulder, impingement of the shoulder, bursitis of the shoulder, snapping scapula, bone spurs, labral tears, rotator cuff tendonitis. And then, so there was 94 patients, 60% were females. The average age was 54. They saw 3 physicians on average before they came to the clinic. 4.4 years of pain. They were on 1 or 2 pain meds. After the prolotherapy was done, the average person was only on 0.3 meds. So in other words, most of the patients got off of their meds. 97% had pain improvement. 93% had improvement of stiffness, and 90% had improvement of the clicking, grinding, popping. Then we looked at 94, we treated 94 patients. 37 were told before they came to the clinic there was no other treatment option. 20 of the 94, the doctor said surgery was their only option. And if you look at this, in the surgery only option, 90% of them received greater than 50% pain relief with the prolotherapy, which is significant. And remember, this is a charity clinic. We weren't using PRP, we're just using dextrose. There was no exercises given. It just was a charity clinic where 300 to 500 patients were treated in a weekend. So see how the difference, there wasn't much difference between all the patients and the surgery only. So the pain levels went from a 7 to a 2, 7 to a 2, 7 to a 2. So it means on average the patients had significant pain improvement, and they got back to exercise, and we even found there was significant improvements even in anxiety and everything, and it reached statistical significance. And then this is kind of how the treatment was done. We would do the posterior ligaments, we do inside the joint, and you could see here a comprehensive ligament treatment, doing the posterior glenohumeral ligaments there. You could see this particular person, I mean, this wasn't one done at the charity clinic, this was in private practice, but this person already had their neck done. So we'll go ahead doing a comprehensive Hemwall Hackett prolotherapy treatment into the back of the shoulder. And all the shots there are going down to the bones. You can see how much force it took to, and you could just see, like, prolotherapy's akin to spot welding. Like, every place the shots are, and I'm hitting the bone, now I'm doing the acromioclavicular joint, which is the top of the shoulder. So we did the back of the shoulder, top of the shoulder. And the shoulder joint is actually many joints. It's the front glenohumeral joint, the acromioclavicular joint, the posterior glenohumeral joint. You could even say there's a joint that is the scapulo-rib joint. So now we're going to do the front. So you could see it's marked out. So I'm doing the ligaments and tendons, rotator cuff tendons and everything in the front. So for educational purposes, I just marked it out. You could see all the shots are hitting the bone. The patient's doing really well. This particular patient, though, you see the tubes, they're breathing nitrous oxide, which we have in the office. When we did the charity work down in Thebes, Illinois, as a Christian charity clinic, there wasn't any of that. So the patients all received this without any pain meds. But you could see that the treatment itself is actually very quick. Going all the way down to the bone. So this is what we consider Hackett-Hemwall Hauser prolotherapy, or what we would say is comprehensive prolotherapy.